Journal of American Urology, space testosterone. That's one of the most revered journals in the world, which is why I send people there. If you're a physician and you disagree with that, go to that journal, and all the research is cited. So you want your red blood cell count to be in the upper end of the normal range. And then you want to keep an eye on hemoglobin, which is the fluid in the red blood cell. You want that towards the upper end of the range. And you keep an eye on something called hematocrit. Hematocrit is a measure of your blood's viscosity. It tells me how close is your blood to water or how close is your blood to motor oil. As your hematocrit rises, your blood is thickening. Easiest way to reduce the viscosity of the blood without blood thinners is to do regular blood donations. We call it therapeutic phlebotomy. If you are taking testosterone therapy, your doctor should probably be recommending that you do regular blood donations. This for men is very healthy, right? If you look at the incidence of cardiovascular disease between men and women, you'll see that men lead women by a huge margin until women stop menstruating. Then there's a parabolic hockey stick spike and they begin to approximate men in the incidence of cardiovascular disease. Why is that? Because they stop turning their blood over, right? So doing regular blood donations for men is very healthy, unless you have something going on.
I'm not doing that. Does it show that I'm not doing that? I should be doing that.
Yes.
What is it? What is regular?
Every 3 to 6 months.
Okay.
Yeah. Your hematocrit is 50.2, which is considered pretty thick. At 51, you're 0.8 of a point away from being having clinically thick blood.
Okay.
Right. So from being clinically out of the range. What you will notice, you feel better right away.
Okay.
Lots of clinics will also, if you're one of those people that gets lightheaded from donating blood, you're not getting lightheaded from the loss of blood. You're getting lightheaded from the loss of pressure because the amount of pressure in the system is fixed. So if I pull a pint of fluid out, the pressure drops, you get lightheaded. So the way to solve that is to talk to your doctor about running an IV, put 500 milliliters of just thin, clean fluid in, then put the bag below the level of the heart, pull 480 to 500 milliliters of thick, old, tired blood out. The pressure will remain the same.
Okay.
The viscosity will change.